Good afternoon. This is in response to the letter I received from Ms. Shireen Godes, Group Leader of Nursing Students from Jose Rizal University, conducting an interview with their Fundamentals of Nursing Practice subject. So this is my answer regarding their questions.
Future nurses, I am Melissa Rabiego, a registered nurse working at DOH Region 1, deployed at RAHU Santiago, Ilocos Sur.
Good day, Nurse Cynthia and Nurse Amelisa. We are glad to have an interview with you for today. So for our first question, as a nurse, how has this pandemic changed your practices in life?
So my answer to that is, first, I need to be flexible and adapt the current situation I am in. So even if I am used to the usual daily practices that I do, I need to have a positive outlook and apply what's best in the current situation. Because of that, I was able to adjust the changes and apply the present practices that needs to be done.
COVID-19 pandemic really changed my practices in life, from the very obvious, which is wearing of face mask, face shields when going outside in public, and it changes my views in my profession.
Thank you. For the second question, how do you think nurse managers like you will enhance their practice to lead nurses towards the best care method?
In this profession, nurses need an unwavering commitment and dedication towards quality patient care. They also need to have a professional growth and development within themselves to be updated with the current trends and practices towards nursing profession.
I agree that having the right attitude is way more important than being knowledgeable. So in order to lead the new nurses toward attaining the best care method, I will emphasize the importance of a good attitude, not just in dealing with every patient and co-workers, but in our everyday lives as well. It is true that nurses should be knowledgeable about correct nursing interventions, but one should have a good attitude so as to apply it correctly and obtain a positive outcome.
Third, as a nurse manager, how would you describe the organization's working culture you belong to?
So actually, we have a cooperative, collaborative, and organized working culture within our organization. It is because our organization collaborates within the different organizations of the hospital so that we can successfully implement our mission and vision and performs our duties and responsibilities effectively. We also follow our organization's rules and regulations and always do mentoring and coaching, making sure that staff and organization is well organized. Also, when our organization implements a program, all staff cooperates for the success of the program.
A rural health unit, which is a primary healthcare facility where I am currently working, is mainly focused on preventing diseases, illnesses of our clients. Patients don't just go to RHU to avail health service, but we, public health nurses, go out in the community to render health services that the people needed.
Fourth question is, can you tell us the day-to-day responsibilities of being a nurse manager?
So as to my current position, which is Nurse 4, I am more on supervisory functions. These are some of my day-to-day responsibilities. First, checks daily schedule for the presence of staff on duty in the clinical area, making sure that they are complete and if there's any absences. Second, check current situation set up in the clinical area. Number 3, communicates within the team leader regarding issues and concerns that needs to be addressed, both staff and clinical concerns. Number 4, performs administrative and supervisory job. Number 5, receive, disseminate, monitor records and reports, and also assist staff on duty in the actual patient care when needed. And number 7, making sure that staff is performing their duties and responsibilities very well and that they render quality patient care.
The day-to-day responsibilities of a public health nurse are implementing health programs accordingly, such as implementation of Res Bakuna, a COVID-19 vaccination activity, conducts health educations and ensures timely data collection and reporting.
Fifth question po is, what advice would you like to give nursing students like us who will be the next leader in healthcare institutions?
So first, commitment and dedication, because being a nurse is a vocation. You need to love and embrace your profession to effectively perform your duties and responsibilities of being a nurse. You also need to equip yourself with knowledge and enhance yourself with the present trends and practices for you to be updated. And also be innovative, creative, develop yourself to be a good leader and role model.
Set a definite goal and create a definite plan on how you can attain the goal. You should also know the purpose of why you choose nursing as your profession, because that will drive your desire to pursue your nursing career, and always ask God's guidance throughout your journey.
Our sixth question is, why did you choose to work as a nurse manager?
Nursing was not my first choice, and I only took nursing because of peer pressure. But I pursued my nursing profession, currently working under the Nurse Deployment Project of DOH.
For our seventh question po, what message do you have for the future generation of nurse managers?
Of course, undying commitment and service, love your profession, be compassionate, render tender loving care, act professionally, render quality patient care, and be a leader on your own way.
Becoming a nurse is one of the most rewarding and fulfilling career path, with each professional hours dedicated to helping, healing, and nurturing those around you. Congratulations for taking this path, my future colleague.
And for our last question, what are some of the most common challenges you've faced as a nurse manager and how did you handle them?
Most common challenges I encountered: first, handling subordinates, because I am responsible with their performances and actions. If they encountered negative result within the practice of their profession, I will be responsible in handling them and resolve whatever issues may arise within my subordinates and the working environment. I handle it by resolving such issues and concerns through planning and implementation.
Dealing with a difficult patient is one of the most challenging part of being a nurse. Encountering such things, I handle it by becoming calm.
Okay, thank you very much and good afternoon to all.